And good morning. Welcome to Community Voice. Today is Thursday, December 15th. I'm your host, Josh Engel. Today we have Dr. Allison Key joining us in the studio. She serves as the medical director for Be the Light Medical Missions, Inc., along with, a few other things. She is a family physician who has been serving in her rural hometown of Bremen, Georgia for the past 10 plus years. She's also the owner of 316 Healthcare, of the 316 Healthcare family of businesses, which include, of course, her medical practice, 316 Family Medicine, which often hosts free clinics for patients in the community. She also owns Spa 316, the premier wellness spa in the West Georgia area. Dr. Key's love of Jesus and enthusiasm for helping people make her a natural fit for Be the Light Medical Missions. Now, Be the Light Medical Missions is a faith-based nonprofit organization founded in 2019 by a group of friends, family, and healthcare workers who genuinely wanted to make a difference in people's lives through free healthcare services. We are live streaming on our WLBB Facebook page, so if you have any questions or comments for our guest, feel free to read those in, and I'd be proud to read them out to Dr. Key. Good morning, Dr. Key.
Good morning. How are you?
I'm great. Thank you so much for coming on the program.
I'm glad to be here.
And talking about such a great mission you guys are working on.
Yeah, super exciting stuff. Good stuff.
Very much so. So it's why don't we get right to you? Mm-hmm. So tell us a bit about Dr. Allison Key.
We have already discussed that my first job ever, how far back do you want to go?
Let's go back to radio. Let's go all the way back.
My first job ever was at WGMI 1440 AM, which sadly is no longer a station, as of recently, no longer a station, but I was the afternoon DJ. I was 15. My mom would drive me out there and drop me off.
This is why you're so well spoken. She just dropped you off.
Perhaps. Yeah. Good luck on the radio today. So that was my first job. No, I grew up in Bremen. I went to West Georgia, the University of West Georgia, got a degree in chemistry. Sort of always knew that I wanted to be a doctor. Don't ask me why. I tell people because I like helping people. That's the right answer. The truth is I'm nosy. And when you're a doctor, you can ask people anything you want to.
Anything you want to.
Not really. I don't know. It was just kind of the dream of my heart. I thought I wanted to be a pediatrician until I held a baby as it died, and I was, a wreck, and I thought I can't do this for everybody. I do love kids. I was very fortunate to grow up with my grandparents around. They're still around, most of them, thank God. So I love older people. So family medicine was just a natural choice. You get to see all ages and do a little bit of everything. And especially when you live out in a more rural area, you really have to know something about everything. People can't always get to a specialist or can't get in with a specialist for months and months. So we manage a whole lot of different things. And I also just sort of believe to some extent that God put on this green earth what we need to be healthy, and that there is more to being well and healthy than just your physical health. There's an emotional and a spiritual and a whole self kind of concept between wellness, and that looks different for different people. And so this idea of like the holistic, I like to incorporate some of that, and I really like the spa side of things too. I feel like women especially, we're wired to want to feel beautiful. There are biblical themes behind that too. So I came back, I did my residency, family medicine residency in Rome at Floyd. We were the only residents in the hospital at that time, and so we managed a little bit of everything there. So I felt pretty well equipped when I came back. Started practicing in Bremen. Worked with some wonderful people for about 9 years, but still just had this nagging there's something else I need to do. And so I should write a book someday about all the series of things that went into this. But God just, He directs our steps. And I wound up jumping ship and opening my own practice. I don't know a thing about running a business. People ask me questions. I'm like, don't ask me. I'm learning as I go. I surrounded
myself with great people, and I'm learning as I go.
Exactly. That is the one big piece of advice I give people is you cannot do anything great on your own. You're never going to know everything. You're never going to have all the answers. So you got to surround yourself with people who know more about different things than you do or have different skill set than you do. So I have a team that's jam up. They're
amazing.
Do it without them. We say we're replaceable, but they are irreplaceable to me. So we feel very strongly about giving back to our community and kind of meeting people where they are. And I know, again, having grown up with my grandparents, sometimes my mom can't get out and come to the doctor, but she needs some help or needs to be seen. So we started out with the idea that we're going to do house calls when we need to, and we're going to offer some free clinics because not everybody can afford to go to the doctor, and we don't need to clog up the ER with things that are either preventable or could be handled as an outpatient that aren't really an emergency. Your bone's not sticking out. So we started doing that, and then we went on our first foreign medical mission trip. My aunt and uncle run a mission in Honduras, which is the second poorest country in the Western Hemisphere behind Haiti. And you want to talk about poverty. My Uncle Marty is always fond of saying, once you see it, you can't unsee it. It's just something you have to see and experience.
You carry that with you for the rest of your life.
Yeah, you really do. And we, so we came back and we got together, a group of us, and we said, well, let's start this nonprofit. We'll start Be the Light Medical Missions. It will enable us to kind of fundraise for foreign medical mission trips, but also fundraise and be able to provide services here at home that people need, just meeting those basic needs. I said to you earlier, if you're hungry or you're cold, you're not really worried about your blood pressure medicine. You have to sort of sometimes take care of the first things first, and then we'll get to the other things to kind of help you be healthier. So that's what we did. We had my church growing up, still my home church, donated a van to us, so we did offer patient transportation. You can't get to the doctor, we'll come get you and take you to the doctor, or we'll take you to your specialist appointment free of charge. We'll just help you get there. Just sort of simple things. We have little food pantries. You're hungry, go get you something out of the pantry, whatever. So we do that, and then my practice exploded. It's more than I ever dreamed it would be. It's crazy. It's I feel like I'm living in a dream sometimes, but I just sort of started praying, there's only so much that we can continue to do and people we can continue to take care of. And I really want Be the Light to grow and be able to do things. And of course, COVID made everything hard for everybody.
Yeah.
But last year, Miss Sue Brockman approached me, and a lot of people know her previously when the Ralpha Clinic first got started. She and a few other nurses and doctors, some retired, some still working, said, we really have this dream in our heart. God has just sort of spoken to us about doing a mobile clinic. Not everybody can get to the doctor, but if you do a mobile clinic, you can get to them. They had read an article, I think, and I'd read the same one about a dental bus, like an RV that's set up as a dental bus in Appalachia, and they go out all through the mountains and provide free dental care. And so that's kind of their pie in the sky dream. But they had these hurdles, and I said, well, I have those things taken care of. What I need is
what you guys are working on.
So we sort of married these two ideas together, and it was just an answered prayer on both parts, I think. So now Healing Grace Mobile Clinic is a ministry of Be the Light Medical Missions. So we've partnered with several area churches, and one of the nurses who volunteers donated a whole house in Bremen to be kind of our home base. So we have a home base clinic for Healing Grace Mobile Clinic. There's a free clinic there every Monday. And then several area churches have partnered with us, currently hosting one free clinic a month in each area. So from Cedartown to Rootville and all around, we have these free clinics. So right now we're at about 8 to 10 free clinics a month and in various locations. Patients can call the 316 Family Medicine office and get an appointment with one of those clinics. Like, our goal is to eventually have full-time staff who answers the phone, makes the appointments. The RV clinic, that goes around. We want more healthcare providers to volunteer their time. Times can be flexible. It's a crazy time of year in healthcare. All the sick season and...
It's cold, it's wet, it's rainy. People got the sniffles, people's got the flu. Some people's Thanksgiving's being interrupted by the flu or some semblance of it.
Flu-like illness.
Flu-like illnesses, indeed. Well, we need to go ahead and take our first commercial break.
Right.
But of course, we already have a comment. Dr. Key, you're very popular. Our first comment of the morning is from Brian Preston. Brian, thank you for hopping on the WLBB Facebook page. He says, we appreciate all Dr. Key does for our community.
Well, thanks.
Thanks, Brian. And thanks, Dr.
Thanks.
Key. We're going to go and take our first commercial break, but when we come back, we're going to continue our conversation with Dr. Allison Key of Be the Light Medical Missions, Inc., as we break down the organization a bit more, chat about its missions, goals, and things that it is looking for that might help make their mission even more successful. So stay with us.
Health is a journey. It's making better choices, even when it's not easy. It's taking care of yourself and the people you love. At Tanner Health System, we're there for you with every step, with primary care, heart care, cancer care, women's care, orthopedics, surgical services, and so much more. We're dedicated to helping you live and feel your best. So let's get on that journey to health. You've got places to be for many years to come. Find us at tanner.org.
I'm Michael Flynn, Oak Mountain Academy class of 1978.
Katie Flynn, class of 2010.
Justin Flynn, class of 2014.
Logan Flynn, class of 2019.
And I'm Marnie Flynn, current teacher at OMA.
My uncle Richard Orm Flynn, a founding father of Oak Mountain Academy, had a vision to see students become confident leaders who hold a faith-based value system in an academically rigorous environment. We are proud to celebrate 60 years of fulfilling my uncle's vision.
Our family invites you to visit the campus or oakmountain.us today.
And we're back to Community Voice. Today is Thursday, December 15th. I'm your host, Josh Engel, and I'm very proud to have Dr. Allison Key in the studio with us today. We're chatting about Be the Light Medical Missions. We're going to be chatting a lot about that here in a moment, but first, let me let everyone know we are live streaming on the WLBB Facebook page, so if you have a question or comment for our guest in relation to either just, talking about how great they are, or if you just want to have any questions or comments about Be the Light Medical Missions or any of the other businesses that we're chatting about today, other groups that we're talking about today, feel free to type those in. First things first, though, let's go through today's random Christmas trivia cash giveaway question. Please, so when you know the answer to this question, please visit the station's website or gratacommunications.com and just click on the random Christmas trivia cash banner. All you got to do is enter your name, email, phone, your answer, and then one entry from the correct answers will be picked at random daily. That contestant wins $100. You might want to enter this, Dr. Key.
I think I know the answer.
Oh, you do?
Yeah,
oh, all right.
I think I do.
All right. So one contestant each day is going to win $100. And then this weekend, on December 17th at Mike Bell Chevrolet, we are going to do the big cash giveaway where all the winners are going to come together, and then one of those winners, Dr. Key, is going to win $1,000.
That's huge.
$1,000. Perfect for Christmas.
Absolutely.
I mean, Christmas is a full-time job pretty much from like the middle of November to the end of December, so this will make it a little easier. So today's question for Thursday, December 15th, and if you know the answer, don't say it. Don't say it out loud. Yeah, there you go. Thursday, December 15th, what actress made her screen debut as a child in the 1947 movie Miracle on 34th Street? That question one more time. What actress made her screen debut as a child in the 1947 movie Miracle on 34th Street? And let me just say, it's a very well-known actress, so it's not going to be a super difficult.
Such a cute little girl, too.
Precious.
Yeah,
I rewatched
adorable.
a clip from that not that long ago. I was... it's very moving, very powerful. Both that and the remake, I think, from the 90s.
I'm ashamed to say I've never seen either one.
Really?
I haven't.
But it's a cute kid.
Yeah.
So, hey, whether it be Dr. Key or you listening at home, if you know the answer to that question, go on the website, put it in, and then maybe I'll see you this weekend at Mike Bell Chevrolet. So, we got another comment that just came in on our live feed on WLBB. This is from Carolyn Henderson. Carolyn, I have been a patient at Spot 316 and received amazing care. I am happy to finally meet Dr. Key. I am enjoying the program.
Good.
All right.
Good.
Well, thank you so much for tuning in. And someone is trying to answer the question on the live feed. Rick,
don't give it away.
Don't give it away. We can't give it away. But you got an answer. So definitely go to this station's website at gratacommunications.com, Mr. McCarty, and put that answer in because you might win. So let's jump back to Be the Light Medical Missions.
Yes.
Let's take a few steps back and let's sort of break down. I know that you partnered with Sue Brockman from the Rafa Clinic,
Yes.
Formerly of the Rafa Clinic.
Yes.
She had this grand idea, but the logistics and the resources weren't really there to pull it off.
Correct.
Meanwhile, you have the resources and the logistics and the staff, but you didn't really have that mission, that goal that was burning in your stomach. You knew what you wanted to do.
Right.
So you guys came together.
Yeah.
And
was
made it
the
happen.
Perfect. It's one of those situations where you're sitting in a room, you're sitting across from somebody, and you just instantly know God put this together. Like, there's no way this could have come together any other way. This is not coincidence.
Synchronicity. You can feel it.
Yeah. So it was just like, I just knew, like, I got so excited. I think over the course of the past 5 or 6 years, well, for many, many years, but especially since opening 316 Healthcare, when it's right, and I'm kind of a yes person anyway, but when it's right, it's this feeling like this exciting kind of like, this is gonna work, and
this is gonna happen.
Yeah, this is it.
It's like Hannibal on the A-Team. I love it when a plan comes together.
Exactly. A lot of times I feel like it just collapses into place, but either way it happens. But no, I just knew, like, this is what I've been praying for. So we've just sort of married those things together. We're making it work, winging a prayer and figuring it out. And this is such a crazy, busy time of year. I think we really just started with the free clinics in the churches just, 2 or 3 months ago. So we're feeling all that out. Our office was already hosting a free clinic once a month. So we've just sort of tried to merge all the things together. And the goal is eventually to have full-time staff for the mobile clinic, and to have an RV, stacked out as your clinic, stocked. I
can already visualize it. I'm already making a Pinterest board in my mind.
Exactly.
I already got an old Bluebird school bus, paint it white, put a little purple and teal accents on the side, be the Light Medical Missions.
It would be perfect.
Close up the back. You have a little private screening room, treatment room.
Yep.
Now, why is this so necessary for Carroll and Haralson County? Because you're serving the local community.
Correct.
I think that it would be good for listeners to kind of have an idea just the extent of the need for something like this.
Almost 20% of the population in Haralson and Carroll counties live beneath the poverty line and or are homeless. I mean, like living in a car, living in a pay-by-the-week motel, and that includes children. Almost 20%, 1 in 5. It's a significantly higher rate than the national average. And so we think about homelessness. We think about the man laying on the side of the street in downtown Atlanta.
Yep, on the side of on the off-ramp or something.
Yeah,
but this is right here.
Almost 1 in 5 people in our community live in a transient situation or in poverty. They can't always get to the doctor. I think a lot of us take for granted that you're going to open your fridge, there's going to be something to eat. You're going to open your pantry, there's going to be something to eat. You might not have a lot of money in your bank account, but your house is warm and you got a coat to put on, and or you got a home to go to, a door to unlock every day. There are a lot of people that they don't know where they're going to sleep tonight. Children that don't know where they're going to sleep tonight. Yeah.
They need that stability. They need that safety, that psychological reinforcement that they're taken care of and they're okay, but they don't have that.
Right. And as a mom, that tears me up, that they don't necessarily know where they're going to sleep tonight. They don't necessarily know that they're going to be safe. They don't necessarily know that they're going to be warm. They might go to bed hungry tonight.
And as you mentioned earlier, if you're going to bed hungry and you're going to bed cold, you're probably not thinking about whatever medical situation you're dealing with because you don't have the time or energy to put towards that.
Right. And it spills over into every part of their lives. A child in that situation, they don't go to school necessarily on their best behavior, or are ready to learn something. And so it's just a cycle that's hard to break. And so that's a simple thing. Feeding someone, it's a simple thing that we often take for granted. So medical care,
it's different.
Yeah. I tell patients they worry a lot of times about their hospital bills and this and that. Well, you could pay a hospital $5 a month, and you can make arrangements to pay for those sorts of things. And that's easier said than done. I know it's a very stressful situation for people, but you should be able to be seen when you're sick. And so much of disease, and this is primary care, another reason I really like family medicine, is prevention. It's a whole lot easier to prevent an illness than to treat an illness or the repercussions of an illness that has gone untreated for many years. So just helping patients find resources, have access to resources, that hand up like, hey, I've been there too, let me help you get out of that situation. Super important.
So you mentioned earlier that a partial inspiration for a mission like this came from the Appalachian Mobile Dentistry groups that would go through the mountains and try to help people with their dentist, help them with their teeth. A lot of them were below the poverty line, living in very rural areas. So let's talk about let's say you have a family. and they are below the poverty line and they're struggling. And let's say the mother has health issues. What sort of health issues could Be the Light Medical Missions assist her with, and what would that process look like?
So currently, we're trying to be in communities that may be underserved or more remote, churches that are out near where people may be living, staying, that transportation would be an issue. And you make a free appointment. You come in. We get you a resource packet. Like, look, these are places that you can get food, that you can get clothes, that you can get assistance with your utilities, that you can find housing for your family. We try to keep up to date with that information, provide that information to patients, try to figure out what they need. And there are lots and lots of organizations in our community that are just so good at helping. What our particular skill set is, though, is medicine, right? I mean, we're trained and skilled in medicine. So as family practitioners, all ages, a little bit of everything. So whether it's high blood pressure, diabetes, coughs and colds, cholesterol, heart disease, you name it, we probably can do something about it. Wow. And it's about being resourceful as a healthcare provider as well. Nothing's cheap anymore, right? There used to be a lot of free prescriptions like at Publix or a $4 list, and those things are, not so much anymore. So it's about being resourceful and partnering with pharmacies and finding where the cheapest prescription's going to be and figuring out a way to get them their prescriptions. So you just have to help in being resourceful, being a resource for them. Education, a lot of times you don't realize when you go into healthcare that a large part of your job is to be a teacher and an encourager and a coach.
Preventative measure.
Yeah, all the things. If you don't know how to manage hypertension, you don't know, high blood pressure. So if you don't know that salt can make it worse. So it's just about making sure that they have those tools in their toolbox to make life better.
Perfect. Time is 8:52. We need to go ahead and take our second commercial break. But when we come back, we're going to wrap up our conversation with Dr. Allison Key as we further discuss Be the Light Medical Missions. And when we come back, we'll even chat about how you can help. Stay with us.
Health is a journey. It's making better choices, even when it's not easy. It's taking care of yourself and the people you love. At Tanner Health System, we're there for you with every step, with primary care, heart care, cancer care, women's care, orthopedics, surgical services, and so much more. We're dedicated to helping you live and feel your best. So let's get on that journey to health. You've got places to be for many years to come. Find us at tanner.org.
As a believer in the power of education, we are called to set the standard by shaping and empowering the minds of future generations through quality education. Oak Mountain Academy embraces this philosophy, which is why my children attend this prestigious school. I am elated to serve on the OMA Board of Trustees, where together we prepare students and remind them to trust and believe in the power to transform the world. I'm Dr. Brian Bain, inviting you to celebrate our 60-year legacy of academic excellence. Visit us at oakmountain.us.
And we're back to Community Voice. I'm your host, Josh Engel. Today is Thursday, December 15th. We're joined by Dr. Allison Key. She is the founder of the 316 Healthcare family of businesses. You've got the medical practice, 316 Family Medicine, as well as West Georgia's premier wellness spa, Spa 316. We've been chatting about Be the Light Medical Missions, a faith-based nonprofit organization founded in 2019 by Dr. Key and some close friends, including Sue Brockman, formerly of the Rafa Clinic. These folks partner together in their spare time and volunteer to serve the let's say, 20% of the Carroll and Haralson County population, which are below the poverty line and do not have insurance and cannot be treated and have medical issues nonetheless. This faith-based mission has continued to serve, whether it be helping people get to doctor's appointments, helping them get some food, helping them get medicine, or actual treatment at the hands of Dr. Key and the other medical professionals involved. Dr. Key, we only have a few minutes left. Let's talk about what you need. What does Be the Light Medical Missions need to help it have a more successful mission, to help more people? What can the listeners do? What can we do to help you?
Of course, people can make donations. We have a PayPal. You can find us there, bethelightmedicalmissions.org. You can check our website. There's a link there where you can donate. You can mail donations, P.O. Box 728, Bremen, Georgia, 30110. So, of course, monetary donations are always helpful. We need volunteers, particularly healthcare providing volunteers, nurses, doctors, nurse practitioners, PAs, whomever, to volunteer hours. Additional locations, churches that are in more rural settings that that have maybe even have an outreach or know that they have a population in their community, direct community, that could benefit from this. Reach out, let us know. Let's partner together on that sort of thing. Pie in the sky. Listen, I talked about a camper for a long time. Hounded my husband about it. He's like, all right, I got you. He brings home this 1990-something model Mini Winnie out of somebody's chicken house. I said, this is not exactly what I had in mind. No. We don't have that adorable little camper anymore. But that's exactly what I see in my mind's eye is a drivable little Mini Winnie type camper that we can retrofit for a truly mobile medical clinic.
A truly mobile medical clinic.
Truly mobile medical clinic. We're not hauling supplies in and out of this house and doing all these things. We are stocked, set up, ready to roll to go see these people who need to be seen.
Ladies and gentlemen, Christmas is a time of giving. If you don't know that it's Christmas, Dr. Key's red top and her Christmas tree earring should give it away. Right. This is a time of generosity, a time of kindness to our fellow man. If there's someone out there right now that's tuning in, maybe you have an RV that's not a 90s, Spaceballs-esque Mini Winnie, but maybe you have an RV. Perhaps you have one of those old minibuses, right? Not old, but one that will run that could be reconfigured to create a mobile medical unit. Or maybe you just have a school bus. Maybe you are in the midst of redoing a school bus or RV. Please consider talking with Dr. Key about how you might could help make this possible, because I know someone out there has one.
That would be incredible. And
it could do so much good in the local community.
And they're probably feeling that little exciting fire right in their gut right now.
That same light that you have inside you.
This is what I'm supposed to do.
This is it. That's that driving mission that connected you with Sue Brockman.
Absolutely.
And it's helped make Be the Light Medical Missions come together. So if you're tuning in, a cash donation would help make the work easier.
For
and
sure.
may even be able to go towards a mobile medical unit.
Right.
But hey, if you have a vehicle, an RV of some sort, or a school bus, please reach out to Dr. Key and go to. Why don't we talk? That's what we'll talk about. We only have about 2 minutes left.
All right.
I'd love to chat about where folks can learn more. What socials do you have? What kind of updates do you post? Where can folks find out more?
You can find us on Instagram and Facebook. Be the Light Medical Missions. You can find us. We have a website that's going to be redone and going to be super user friendly soon, with easier to make donations or see what's going on. Clinics posted. Be the Light medicalmissions.org. You can also just go to our 316healthcare.us page and navigate to any of those areas. It'll link you to them. You can get to them from there. So that's this. Our socials are probably the best way. We really keep things kind of updated, posted there. Websites are being refreshed, but we're trying our best to keep things updated there as well. So either of those will get you in touch with us. Shoot us an email if you're not sure, info@316healthcare.us or info@bethelightmedicalmissions.org. Those actually come straight to me. So I will be glad to answer questions, put you in touch with the right people, connect the dots. This
is amazing.
Yeah.
So if you're tuning in right now and you would like to try to assist, whether you're a retired medical professional that would like to volunteer, help treat the underprivileged folks in our community, reach out to Dr. Key. You got a cash donation. You help make this work possible.
That's right.
And I'm really holding out for that RV or school bus. I bet someone out there has one, and we can make this happen. I think we can. I'm really inspired by the Appalachian dentistry, the inspiration.
That's
really
cool.
I'll
find that article and share it so that people can see it. There's a couple of nurse practitioners. It was awesome. Yeah.
It's awesome.
Yeah, super cool.
Well, Dr. Key, thank you for all that you do. Thank you for your and your team's stewardship of your resources to assist and help others. Definitely, folks, go check out the 316 Healthcare family of businesses, 316 Family Medicine, and of course, Spy 316, one of my favorite spots in West Georgia. Definitely check them out. Dr. Key, thank you again for coming on the program.
Thanks, Josh. I enjoyed it.
Well, thank you much.
Appreciate you.
And everyone, go check out bethelightmedicalmissions.org. Thank you all for tuning in. We'll see you next time.